Good to see you again. Yeah, in this video, we'll be doing a full APIE mock on a patient that is scheduled for surgery having hernia. Right, it's going to be on assessment, planning, implementation, and evaluation. So with that being said, let's dive directly into it. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left dorsum, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? Right, the reason why I'm here is to carry out a full set of observation on you following A to E approach and to ask you few questions about your activities of daily living. Is it a convenient time, please? All right. Before we continue, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right. So I have here James B. James B. Your date of birth is 0101-1976. 0101-1976. And your hospital number is 1234567. 1234567. Fantastic. Are you allergic to anything at all, please? Oh, you have no known allergy. It is properly documented in my notes that you have no known allergy, and that is why you are on white wristband. How may I address you, please? All right, James. Okay, so assessor, I can confirm I am with the right patient and I'm happy to proceed. Okay, James, I'll be stepping aside now to quickly gather the equipment I'll be using to carry out the assessment on you. And here is the call bell should you need me before my arrival. Is that okay? Right. So, leaving my patient bedside now to gather the equipment, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. Assessor, could you please confirm my equipment are clean, calibrated, and are ready for use? All right, thank you very much. Okay, James, I'm back. Are you still happy for us to continue? Right, thank you very much. So, assessor, I can confirm I have the right size of cuff. Right. So, I can see your legs are not crossed. Can you please confirm with me you've been resting in the last 20 minutes? Oh, fantastic. So, I'll be starting with a full set of observation now. I'll start with measuring your blood pressure first. Okay. Which of the arms would you prefer? Oh, the left one. Okay, good. Right. So, could you please confirm with me if you've had surgery done on this arm previously? Oh, not at all. Good. I can see the arm is visibly clean. There's no sign of infection, no skin lesion. So, I'll be tying the cuff now about 2 to 3 centimeters away from the cubital fossa, making sure it's not too tight and it is not too loose. All right. However, as soon as the machine starts working, you may feel a little tightness around your arm. Do not worry, it's going to be for the time being. Is that okay? Right. Thank you very much. So, having tied the cuff on your hand, is it okay to touch your right arm, please? Okay, so I will be checking for your capillary refill now, depressing your finger for 5 seconds and to see how properly perfused you are. Right. So I can see there is no false nail, no nail varnish. There is no skin lesion, no inflammation of any kind. The finger is visibly clean. So I will go ahead now to depress your finger for 5 seconds. 1, 2, 3, 4, 5. So I'm happy your capillary refilled in less than 2 seconds, meaning you are properly perfused. Right. So I will go ahead now and put the probe now to check for your SpO2, and I will start the blood pressure apparatus at the same time. So your blood pressure reading is 120/80. Your SpO2 is 98%. So I'm going to be unwrapping the cuff as well as the pulse oximeter. Keep them aside. I'll be cleaning them later when I'm done taking your vitals. Is that okay? Right. In the next 2 minutes, James, I would want us to be silent as I will be measuring your heart rate this time. All right. Thank you very much. I'll go ahead now and palpate James' radial artery to check for his heart rate. Assessor, my time starts now. I'm so sorry, James. I actually checked for your heart rate for 1 minute and the other 1 minute for your respiratory rate. I was deliberate not informing you so that it doesn't get altered. I'm so sorry for this. Is that okay? All right. It's an infrared thermometer. It's a device that is used to check for temperature. Right. It is not going to come in contact with your skin. Okay. So are you happy for me to use? Thank you. So I can see Janet's forehead, no excessive sweating. There is no inflammation of any kind, no skin lesion. So I'm happy to check Janet's temperature. I'll go ahead and document that. Okay, so that brings us to the end of the full set of observation, right? Then we'll move to the A to E approach now. So since the beginning of the procedure, James, you've been talking to me in 2 to 3 sentences. I don't want to assume your airway is patent. Could you please make a cough? Great. Can you take deep breathing breath? Fantastic. So assessor, I can confirm James' airway is patent. Right. So moving on to B. The other time I checked for your respiratory rate and the depth. Yeah, the rate was 18 beats per minute, meaning it's within normal therapeutic range. And also the depth was okay. You have normal breathing breath. Talking about respiratory noises such as stridor, wheeze, or coughing, none of these signs were identified during the assessment, so I'm happy with that. Talking about visual signs of respiratory distress such as seesaw breathing, breathlessness, cyanosis, coughing, or use of accessory muscle, none was noted during the assessment also. So I'm happy with that. Talking about your air entry, there is equal air entry, that is the bilateral rising and falling of your chest was happening in a regular interval. Yeah, I'm happy with that. Talking about your SpO2, I got SpO2 reading of 98% and you're saturating on hair. Okay, so I'm happy with that. It's within normal therapeutic range. Moving on to circulation. The other time I depressed your finger to check for your capillary refill. Your capillary refilled in less than 2 seconds, meaning you are properly perfused. I'm happy with that. Your blood pressure was 120 over 80 millimeter of mercury. It is within normal range. I'm happy with that. Also, your heart rate 72 beats per minute was within normal range. There was no irregularity in the strength. So I'm happy with that. Your extremities, the upper and lower extremities, are not too warm nor too cold to touch. There is proper circulation. Moving on to D, that is the disability. Do you know where you are at the moment, James? Oh, good. You're actually in the hospital, right? And do you know what time of the day it is? It is afternoon. Good, good. All right. Do you know who I am, please? Yeah, you're very correct. Well done, James. I'm actually your nurse. Okay. You are oriented to time, place, and person. I'm happy with that. Okay. Right. When last was the time you visited the loo? Oh, in about an hour ago. Great. Do you experience any pain using the toilet? Oh, great. Not at all. Right. I'm happy with that. Right. So, assessor, could you please confirm James' blood glucose level and when it was last checked? Oh, fantastic. Early hour of today and it's within normal. Okay, so I'm glad with the reading. Right. So, are you in any form of discomfort at the moment? Oh, so sorry to hear that. Oh, so sorry. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain, please? Oh, you would say 7. That's quite high. So sorry, James. Where exactly is the pain? Oh, on the left part of your abdomen, around your groin. Oh, I can only imagine how terrible the pain may be now. I'm so sorry, okay? And we're going to do everything possible to make sure you are all right. That is why you are scheduled for surgery so that the hernia can be repaired. All right. So you will feel less pain afterwards. Is that okay? So sorry, Janet. Is it okay to reposition you? So sorry. All right. Can you take deep breathing breath for me? Oh, so sorry. Do you feel any better? Not yet. All right. Have you had any analgesia recently? Oh, not at all. I'm going to be checking through your match chart in a moment to see if you are due for hernia. And if not, I'm going to be escalating your care. And as soon as analgesia is prescribed, I will come back to attend to you. Is that okay? All right. Thank you very much. Are you still happy for me to continue? Can you manage? All right. Thank you. Okay, moving on to E, which is the exposure. The last time I checked your temperature, it was 37.2. I don't have problem with that. It's within normal. And on the part exposed on your body, there is no sign of bruises, injury, or bleed. Could you please confirm if the part covered in your body, if there is anything of such? Oh, not at all. Thank you very much for your time, James. That brings us to the end of A to E approach. So, a quick review on your past medical history. I could read from your notes that you are a known hypertensive patient. Am I correct? Oh, so sorry to hear that. And I could see also that you are on Ramipre. That's what you take on a regular basis to help you regulate your blood pressure. And how well are you complying with this, James? Oh, you have been taking it as at when due. Well done, James. I just want to encourage you to still keep up with your medication because the more we take, the better for our health. Is that okay? Would you be willing to do this, James? Thank you very much. All right, James, I'll be stepping aside now to quickly document what I've done with you, and I'll be back in a moment to relay the findings. Is that okay? All right, here is the call bell. Should you need me, please do use the call bell, and I'll be right back. Right. So, leaving James now to document, I will go ahead and perform my hand hygiene following the 7 steps of WHO standard. Yeah, I'm back. Following the assessment, I come up with a total score of 0. It does mean your frequency of monitoring will be 12 hourly. Every of your vitals checked were within normal therapeutic range. Okay, so do not worry. We're going to be monitoring you 12 hourly prior the time you are taken to the theater. Is that okay? All right. So, few more questions, James. I could see from your notes that you are scheduled for surgery. Is that correct? Right. And have you had any meal recently? Oh, that's true. You were told not to eat anything because you are scheduled for surgery. That's actually true. Well done. What a good memory you have. Yeah, that's good. Yeah. Actually, you'll soon be going for surgery. So I would just encourage you not to eat before then. Is that so you already know what to expect, the outcome, the benefits and the downside of the procedure. Oh, I'm glad to hear this. Good. All right. So you're already prepared. So do you have any question for me at this time? Oh, you are anxious about the outcome of the surgery. It's quite normal for us to be anxious, James, and I understand how you feel this time. But do not worry, the facility is well equipped and you are in safe hands. There are competent hands that will be handling your surgery. So do not worry. We hope everything goes on well. Right. So pending the time you'll be taking to the theater, I would just want to encourage you, you keep taking deep breathing breaths, okay? And you engage in activities that you enjoy most, such as reading or watching TV. This will take your mind off your worries and in turn, it will lessen it. All right. Sound like a plan to you, James? All right. Thank you. So is there any other thing you would want me to know? So before your surgery, we'll come to be checking up on you. Is that okay? So let your mind be at rest. Is that fine? So how do you mobilize, if I may ask, Janet? Oh, good. You do that independently. I'm glad to hear that. Right. So you don't need any assistance regarding that. Okay. So are you sleeping all right? Your sleeping pattern? Oh, you've been sleeping all right, not until recently when you were told you are going for surgery and you became anxious. It's quite normal. Okay. I just want to encourage you to be taking deep breathing breaths each time, and this will go a long way to help you. Is that okay? So, have you been taking through the consent form? Have you signed the consent form? Okay, good. So I will come back to measure your feet for anti-embolic socks to prevent thromboembolism. Is that okay? All right. Can I confirm with you if you drink or smoke? Oh, all right. Not at all. Glad to hear that. Okay. So that's fine. I'll be stepping aside now. So anytime you need anything, just press on the call bell and I'll be here to attend to you. Is that okay? All right. So do you have any other concern apart from you being anxious that we've addressed? Okay, thank you very much. So here is the call bell. Should you need me, do press on the call bell and I'll be here to attend to you. So leaving James now, I will go ahead and clean the used equipment in preparation for the next use. Also, I will go ahead and perform my final hand hygiene following the 7 steps of WHO standard. All right, colleagues, that brings us to the end of the assessment for this patient that is scheduled for surgery. I will see you shortly in the planning station. Thank you for staying with us. Yeah, I'm back. Let me quickly take us through the care plan I've got for us. So the first one is Janet is experiencing anxiety due to unknown outcome of the surgical procedure. Yes, the aim of care is to relieve James' level of anxiety, or James will verbalize relief of anxiety by asking fewer questions about the surgical procedure. The reevaluation date is today, your exam date in bracket open and close, according to your NILS 2 chart score, or sooner if the clinical condition changes. Your interventions now: explain and discuss all aspects of care to James and obtain informed consent. Monitor and record James' vital observations every 12 hourly and escalate as per NILS 2 policy. Assess James' level of anxiety by asking questions related to the surgery and identify James' specific fear, such as anesthesia, pain or outcome of the surgery. Teach or educate James on the procedure to allay his anxiety. Allow James to verbalize his worries and reassure accordingly. Allow open visits to James by the family, as this will facilitate free interaction to allay fear. Administer prescribed medications, monitoring effectiveness and side effects after 30 minutes of administration. Refer James to surgical team for further clarification on the procedure. Demonstrate and inform James on the appropriate use of cowbell. Document all aspects of care as planned. You have successfully written the first care plan. Moving on to the second care plan, which is pain. James is experiencing pain in his right groin area due to Inguinal Hernia with a pain score of 7 out of 10. The aim of care: James will verbalize relief of pain following nursing interventions with a pain score of between 0 to 3 out of 10. The reevaluation date is today, your exam date in bracket open and close, every 30 minutes or sooner if the clinical condition changes. For the nursing intervention, explain and discuss with James all aspects of care and obtain informed consent. Monitor and record James' vital observation and escalate as per NILS 2 policy. Assess James' level of pain using pain assessment tool. Teach James diversional therapy such as reading novels or watching TV. Administer prescribed medication, monitoring effectiveness and side effects after 30 minutes. Demonstrate and inform James on the use of cowbell. Document all aspects of care as planned. You are done with the second care plan. So I've got a bonus for you as usual. So the bonus is James requires safe preparation for surgery. It's not a problem, but it's a need. And it's a good care plan to write for any patient scheduled for surgery, especially if there are not too many things to plan the patient on. Yeah. So your aim of care is James will be safely prepared for surgery or to safely prepare James for surgery. Your reevaluation date is today, your exam date in bracket open and close, depending on the time the patient is scheduled for the surgery. So you can do 2 hourly prior or sooner if the clinical condition changes. Your interventions now. Explain and discuss all aspects of care to James and obtain informed consent. Monitor and record James pre-op vital observation and escalate as per News 2 policy. Ensure consent form is signed by James with the surgical team. Teach James the importance of at least 6 to 8 hours fast prior surgery. Administer pre-op medications except stated otherwise by the surgeon. Monitor effectiveness and side effects after 30 minutes. Refer James to medical surgical team for proper preparation. Demonstrate and inform James on the use of cowbell. Document all care as planned. That brings us to the end of the care plan. I will see you shortly in implementation station. Thank you. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left thumb, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? Right. So the reason why I'm here is to administer your due medications for 1400 hours. Is it a convenient time, please? All right, thank you very much. Before we proceed, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? So your name is James B. James B. Your date of birth is 0101-1976. 0101-1976. Your hospital number is 1234567. 1234567. Perfect. Assessor, I can confirm I am with the right patient. All right, so how may I address you, please? All right, James. Okay. Are you allergic to anything at all? Oh, you have no known allergy. It is properly documented in my notes that you have no known allergy, and that is why you are on white wristband. All right. Is it okay to take you through your medication record chart? All right, fantastic. So I have the hospital mark chart for James B. The date of birth is 0101-1976. The hospital number is 1234567. The ward is preoperative or surgical ward. The date of admission is today. The height is 1.65 meter. The weight is 72 kilogram. The body mass index is not stated. The consultant is Dr. Tolu. The time of admission is 10:00 hour. Under the page where the prescriber should enter their details, I have the name Dr. Tolu. The GMC number is 1234567. The signature is properly appended. The blip number is 123. Under the details of the person administering the medication, which is me, I will come back to append my signature and other details appropriately after I might have administered the medications. Under alert and allergies, James is not allergic to anything, so the box no is ticked. Under medication risk factor, there is no medication risk factor ticked for James. I move on to the next page. I still have hospital match chart for James B. The date of birth is 01/01/1976. The rest of information on this page is as the same as the previous pages. Under the code, I've read and understood the code and I will be using appropriately. Under once only medicine, the date is today. The drug is cefuroxime. The dose is 1.5 milligram. The route is IV. The time required was 1000 hour. Prescriber details is properly documented. The time given was 10:30 and the signature of the person that has given it was properly appended, that is a senior colleague. The pharmacy check was properly done. It is a valid and legible prescription, however, it has been previously administered. I move on to the next medication, still under once only. The date is today. The drug is midazolam. The dose is 2 milligram. The route is IV. The time required is 1400 hour. Prescriber signature and other details is properly documented. It is a valid and legible prescription. However, I'm not going to be administering midazolam because I am not yet certified to administer intravenous medication. I'm going to be escalating this to be reviewed by the nurse in charge. Timely administration is going to be ensured. So I will go ahead and code that, a code of 10. So I will go ahead now and code the medication under where I should sign normally if I had given the medication. So I will write a code of 10 and I will sign against it. I will turn to the last page of the match chart and I'm going to document. The date is today, the time is 1400 hour, the drug is midazolam, the dose is 2 milligram, the route is IV, the instruction is for anxiety. The reason for omission is nurse not competent to give IV, and I will sign appropriately. Okay, so I'll go back now to my medication. So I move on to the next page. I still have hospital match chart for James B. The date of birth is 01/01/1976. The rest of information on this page is as the same as the previous pages. Under prescribed oxygen, there is no prescribed oxygen for James, and James is not a known CO2 retainer. The box no is ticked for James. I will move on to the next page. I still have hospital match chart for James B. The date of birth is 01/01/1976. The rest of information on this page is as the same as the previous pages. Under antimicrobial, there is no antimicrobial prescribed for James. I'm happy to proceed. Under regular medicine, the drug is enoxaparin. The date is today. The dose is 40 milligram. Frequency is once daily. The route is subcutaneous. The duration is 7 days. The start date is today. The finish date is +6 days. Prescriber signature and blip is properly documented. It is a valid and legible prescription. However, it is not due at my time. There is no other regular medications prescribed for James. So I will move on to the next page. So I still have on this page the hospital match chart for James B. The date of birth is 01/01/1976. The rest of information on this page is as the same as previous pages. Under as required medicine, the drug is paracetamol. The date is today, the dose is 1 gram. The frequency is 4 to 6 hourly. The route is per oral. The duration is continuous. The start date is today. The finish date is continuous. Prescriber signature and blip is properly appended. It is a valid and legible prescription. All right, James, could you please confirm with me if you are still in any form of pain? Oh, so sorry to hear this. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain? Oh, you will still say 7. That's still quite high. You are due for analgesia now. That is paracetamol. I'm happy to administer it because it has not been previously given in the last 4 to 6 hours, and your weight is obviously above 50 for the recommended dosage. I'm happy to give. So I will not be appending my signature now until you are done taking the medication. All right. So what paracetamol does is it relieve mild to moderate pain. All right. And some of the side effects you may or may not manifest include, and not limited to, nausea, vomiting, or abdominal disturbances. Are you still happy for me to administer the medication, please? Okay, good. Thank you very much. All right. Still under as required medication, I've got ondansetron. The date is today. The dose is 4 milligram. The frequency is 8 hourly. The route is per oral. The duration is 2 days. The time is 1400 hour, which is my time. The start date is today. The finish date is plus 2 days. The prescriber signature and blip is properly documented. It is a valid and legible prescription. Can I confirm with you, James, if you are having nausea at the moment? Oh, not really. Okay. So the ondansetron is to be given when necessary. All right. So because you are not having any form of nausea at the moment, you might not need to take this. Okay. So I will not be giving ondansetron and I will not code it. Obviously, James is not having any form of nausea at the moment. So I will not be coding because it's under as required. Right. So I move on to the next page. I still have hospital match chart for James B. The date of birth is 01/01/1976. The rest of information on this page is as the same as the previous pages. Under infusion, there is no infusion for James, right? And under omitted page, if I omit any other medication, I will come to document appropriately. All right. With that being said, I'll be stepping aside now, James, to prepare your medications. Here is the call bell should you need me before my arrival. Is that okay? All right. So leaving James, I will go ahead and perform my hand hygiene following the 7 steps of WHO standard. Assessor, could you please confirm the medication cupboard is under lock and key and will only be opened for the purpose of this medication administration? Right, thank you very much. So I have on my hand paracetamol. 500 milligram is the stock dose. It is not expired. The expiration date is February 2026. And I will go ahead now and compare with my prescription to be sure it is the same medication that is prescribed. Yes, so I have on my hand as well as on the prescription paracetamol. 500 milligram is the stock dose and 1 gram is prescribed. It does mean I will be taking 2 tablets of paracetamol to my pot. Okay, so in an aseptic manner now, I'm going to be opening the lid, dispensing 2 tablets without my hands contacting the medication, then from lid to the medicine pot, and I will secure the lid back to the container. I put it aside. So prior to every medication administration, the 6 rights of administration principle needs to be ensured. That is, the right patient, the right medication, the right dosage, the right route, the right time and date, the validity of the prescription, as well as the proper documentation of the medication. I have all my 6 rights in place, so I'm happy to proceed. Because paracetamol is the only medication I've got to administer to this patient, I have dispensed it. So I'm going to be performing my hand hygiene now, following the 7 steps of WHO standard as I go back to the patient. Right, I'm back. Thank you very much. Are you still happy for us to continue, James? Yeah. So could you please quickly reconfirm your details while I double check with my paperwork as well as against your wristband, please? Thank you very much. So I still have James B. All right. And James B. Okay. Your date of birth is 01/01/1976. 0101 1976. Your hospital number is 1234567. 1234567. Fantastic. You said the other time that you have no known allergy. Am I correct? Right. So, assessor, I can still confirm I am with the right patient. So, I'm happy to proceed. Okay. So, do you want the medication with water or squash, please? Okay, you want it with water. Fantastic. Do you want the medications together or separately? Oh, together. So you've got just paracetamol here, just going to be the two tablets alone, right? All right, James, can I confirm with you if you have any difficulty swallowing, please? Oh, you have none. Are you having any nausea at the moment? Oh, not at all. Fantastic. Right. So do you want the medications with water or squash? Water is okay. Do you want to take the medication separately or together? Yeah, you've got just paracetamol here and it's just two tablets. Right. Okay. Yeah. So here is the water first, and this is your medication. Fantastic. Could you please confirm you have taken the medications by opening your mouth? Assessor, I can confirm James has safely taken his medications. Right. Okay. So I'll be stepping aside now to quickly document what I've given you, and I'll be back shortly. Is that okay? All right. Thank you very much. Yeah, I'm back. Yeah, are you comfortable? Okay, so I'll still be with you for let's say 30 minutes. And after I might have left, if you feel anything unusual, right. So you can press on the call bell. Here's the call bell, okay, and we'll be here to attend to you. Is that right? All right, thank you very much. So leaving James' bedside now, I'll go ahead and lock the medication cupboard and keep the key in the place of safety. Right. Then I will clean my pots, the used pots, in preparation for the next use. And I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, colleagues, that brings us to the end of implementation station. Thank you for still staying tuned. I will see you shortly in evaluation station where we'll be handling over this patient. Yeah. For situation, hello, I'm Kenny, one of the nurses on the general surgical ward. I'm here regarding James B, a 49-year-old patient who is scheduled for elective right inguinal hernia repair later today. Right, so for the background, James B presented with a 4-month history of a right side growing lump, which has become more uncomfortable recently, particularly when coughing, lifting, or standing for long periods. His past medical history include hypertension, well controlled with amlodipine 5 mg once daily. He has no known allergy and takes paracetamol as needed for mild discomfort. Socially, James is a retired teacher who lives with his family, that is wife and 2 kids. Is fully independent, smokes occasionally and drinks socially. His regular medications include amlodipine 5 mg once daily that is taken every morning for blood pressure control, paracetamol 1 gram, that's when necessary, used as needed for mild discomfort or pain. At this admission, cefuroxime 1.5 gram IV start prescribed pre-operatively for antibiotic prophylaxis. Midazolam 2 mg IV start to manage anxiety. Enoxaparin 40 mg subcutaneously once daily prescribed for venous thromboembolism prophylaxis. Upon James' initial assessment, he had a total NIL score of 0 and the frequency of monitoring was 12 hourly. Moving on to assessment, the most recent assessment for James is as follows. Temperature 37.0, pulse 86 beats per minute, respiration 16 cycle per minute, blood pressure 130/80 of mercury, SpO2 reading of 98%. Compared to the initial assessment that was done, nothing has changed The vitals is still the same as normal as it was. Upon initial assessment, two nursing needs were identified for James. The first is James was experiencing pain in his right groin with a pain score of 7 out of 10. His pain level was assessed using pain assessment tool. He was taught diversional therapy such as reading and watching TV. Due oral medications were administered. Effectiveness and side effects were watched out for. However, midazolam 2 mg IV start was not administered as the nurse not licensed to administer IV medications. James was referred to surgical team for further plan of care. The second need that was identified is that he was anxious due to unknown outcome of the procedure. His level of anxiety was assessed by asking questions related to the procedure from him and was educated on the unknown to allay his fear. Open visit by family to James was allowed to facilitate free interaction to further allay his fears. His prescribed ondansetron was not administered because it was not due yet. Also, he was referred to surgical team for further clarification on procedure. My recommendation is I would recommend you continue to monitor James every 12 hourly according to the most recent news score. As stated earlier that IV midazolam 2 mg was not administered due to the nurse not licensed to give. Enoxaparin should be administered when due as prophylaxis for venous thromboembolism. James is prepared and ready for theatre. That will be all from my end. Have you got any questions for me, please? Thank you very much. Do not hesitate to contact us to be cleared on anything. So, dearest colleagues, it could be that simple. That brings us to the end of full APIE mock for hernia patients scheduled for surgery. Alright, in case you need help on how to properly prepare for your OSCE, you can contact us on the contact on your screen and we will be more than happy to help you. I will see you in my subsequent videos and until then, keep practicing OSCE. Bye!